members that have joined us today, and especially to our officers who are going to be the ones that are delivering a presentation, but also helping the members of the public with any guidance or further advice that we wish to give them today, but also to answer their questions. We have just a small number of questions today. I'm assuming that it's like the week before Christmas. Exactly. This time next week, we will, for most of us, be celebrating Christmas Day, and it certainly doesn't feel like it, but I do expect that people have a lot of things on the mind right now and other things to do. So it's not, I don't think it's a particular surprise to see that we have less people wanting to join us today than normal. But for those who are with us, welcome. Thank you very much for coming along. And certainly for those that wish to raise questions. I'm just going to ask the board to just quickly introduce themselves because we have got a couple of, I think, new people with us today. So I think most people know by now, I am Councillor Julie Daw, leader of the council and also chair of this Sheffield COVID-19 Prevention and Management Board. So I'll go down. Dan?
I'm Dan Spicer. I'm the Strategy and Partnerships Manager for the council, providing support to the board.
Thank you. Jackie?
Afternoon, everybody. I'm Councillor Jackie Drayton. I represent Burngreave Ward and where I live, and I'm the Cabinet Member for Children, Young People and Families with a special responsibility for public health as well. Thank you, Julie.
Thank you, Jackie. Jamie?
Hi, I'm Jamie Wylam. I'm a Public Health Registrar working in the Public Health team at the Council.
Shafak?
I'm Shafak Mohammed. I'm a councillor in Ecclesall Ward and the leader of the opposition on Sheffield Council.
Simon?
Yes, I'm Simon Verrill. I'm Superintendent in South Yorkshire Police.
The one that looks like a police officer. Greg?
Greg Fell, Director of Public Health.
Thank you. Douglas?
Thank you. Douglas Johnson, Councillor for City Ward and from the Green Party.
Louisa?
Hi there, I'm Louisa, Director at Sheffield Chamber, representing the business community.
And finally, Bob, I think.
Hiya, I'm Councillor Bob Johnson, Cabinet Member for Transport and Development.
Okay, thank you. Can we get to the full screen, please, Dan? That's great. Thank you. Thank you very much. Right, so Greg, over to you to tell us what the situation is in Sheffield.
Okay, thanks, Julie. So I'm going to put some slides up. These slides will be on the website, if not now, then in fairly short order. And someone nod to tell me that you can see those okay?
Yep.
Yeah, great. So these are yesterday's slides. It was up to date as of yesterday. The data's changed a little bit, but the story broadly hasn't. So firstly, epidemiology, where do we stand as of now? In a single slide, you can see the story of the epidemic so far. As of yesterday, the 7-day instance was 125 per 100,000 over the last 7 days. 82 cases a day on average and 5% positivity. So of 100 people who have symptoms and get a test, 5 of them will test positive, 95 will test negative. It's worth bearing in mind that about a month and a half ago, that was 15%, 15%, and the rate of infection was much higher than it is now. So that's the good news. But there's a but, and it's a really important but, and the but is this circle here. That rate of fall has now stopped. And one of the things that we've seen before in this pandemic, from the course right the way from March onwards, that it can turn on a coin, and it would appear to be one of those turning on a coin moments. It wasn't terribly unexpected, but the bad news is that the rate of fall is now flatlining, and the signs is beginning to go back up, and certainly in the many other regions, particularly in northern England, but also very prominently in London and a lot of the southeast, starting to go back up very, very quickly. In fact, it's going up very quickly in London at the moment. So there's no reason to think that will not happen here, hence the need for caution over a considerably longer period. So whilst that's about a week's worth of data in that little circle there, it's of great concern. And as I say, we've seen this epidemic turn on a coin on a number of occasions, most obviously here in September, early October, but here seems to be another turning point. Not just, this is a few days old now, not just Sheffield, but the rest of South Yorkshire. You can see the change from mid-October through to early to mid-December, flatlining in pretty much all of South Yorkshire. Just of note, this is now quite, well, I was going to say it's quite old. It's about 7 or 8 days old. Rising steeply now in Rotherham, and no reason to think that won't happen here as well, hence underscoring the need for caution. Less people are being tested. This is the local data on the number of tests per day, and less people are being tested over a period. Clearly, there are less people with symptoms, but I also suspect in this there's some testing fatigue. I just can't bring myself to go and get a test, and less people are approaching for testing, which is a concern, and I'll come back to that later. Household to household transmission remains key. These are two weeks worth of data. This was the week on the left is the week before last. This is last week, and this week's data I've only just received this morning, so the slide isn't up to date. Is of a similar pattern. Concentration in the east of the city, but actually there are cases across the whole city. In terms of where the transmission is happening, in households. That's been the case from the start of the pandemic throughout. There is transmission in other settings, no doubt about that. You know, doesn't magically happen in households. It's acquired from somewhere else, but most of the onward transmission is within households. We spend most time there. Our guard is down. They're the least COVID secure environments, and as a result, most of the transmission is within households. An infection within an individual household is not a big deal epidemiology-wise. It is a big deal if someone becomes seriously poorly. I'll make no bones about that. But epidemiology-wise, it's the mixing between households that leads to acceleration through new social networks and new social groups. Hence my cautious approach to Christmas, because there's no doubt about the fact we will mix households over Christmas. So back to the previous slide. Here we do need to be careful over the next period, months actually, I think. So the incidence in the elderly has fallen. Two versions of largely the same graph with different time frame on this. This is a longer term view from November right the way through to this is the most recent data. Way back in November, the age-specific incidence in the elderly, the over 65s, was 400 per 100,000. It's now about 130 per 100,000. Obviously, that's good news. Our analytics team were hugely excited they could get the green pen out to do some of the marking as opposed to their red pen. And again, it's an important but. You can see the shape of the line for yourself. This is the most recent data for the elderly 7-day incidence of COVID-19. Flat, starting to rise, and that's of great concern because it's the elderly that are most likely to be seriously ill and end up in hospital or worse. Hence the need to protect the elderly throughout the coming period because they are most vulnerable to severe illness. The reality is that many people who are older who have COVID would be okay, but a significant proportion won't be. So we do need to take special care to protect those that are most likely to be seriously ill. Hospital activity is falling very slowly And this is the data for Sheffield Teaching Hospital. Again, it's the chart at the bottom, which I think you put most of my energy and attention to. 3 colours: blue is patients receiving oxygen, red is patients receiving non-invasive ventilation, and the orangey is patients receiving mechanical ventilation. The indicator of the most seriously ill people, the most seriously ill group of patients. There are a not insignificant number of people still in hospital with really quite complex COVID-related conditions. It's somewhere between 15 and 20% of beds in Sheffield Teaching hospitals have a patient with a diagnosis of COVID-19 in it, and that's going down slowly. The good news is that more people are surviving. Treatments have improved inordinately since March, no doubts about that. There's bad news to that, and the bad news is whilst they survive, they have very complex illness and therefore have quite long lengths of stay in hospital. There's very limited room for manoeuvre here, and the hospital remains particularly busy part of the health and social care system, again underscoring the need for caution. There has been a significant increase in deaths. This is the daily number of deaths registered in Sheffield Hospital and community throughout the whole course of the pandemic. And you can see the two peaks for yourself. That's fairly obvious. Ignore the significant tail off here forward. That's just because we haven't had the death certificates yet, but there've been a significant number of deaths in the second wave. And I don't think that has yet reached its peak. It may be getting to its peak, but that all depends on whether or not there's a significant further takeoff of COVID-19 infections over the next couple of weeks to a month or so. If there are infections, there will be people who develop very serious illness, and of those, some of them will be hospitalized, some will sadly die. So it's too soon to call whether or not we've reached the peak of the second wave, peak of deaths in the second wave. Summary. R0, the measure of infectiousness, is somewhere between 0.7 and 0.9, but with a high and now static baseline. In summer, R0 was 0.6 and the level of infection was about 20 per 100,000. Now it's, let's call it in the middle, 0.8, with a level of infection of about 125 per 100,000. That's very worrisome. 125 per 100,000 over the 7-day period. Rate of decline is now flatlining in the whole population and the over 65s, and it's too high. Positivity is 6.5%. I think that will start to go up, and again, that's an indicator of more disease in the community. A significant proportion of Sheffield Teaching Hospital's bed have a patient with COVID in them. That's very difficult for the hospital to manage, and credit to the hospital who have moved mountains to provide the best possible care for all of their patients, including those with COVID-19. But it's been difficult is an understatement. Thus, as a city, we mustn't do anything that will make it worse because the numbers are too high for comfort. Forward look, rates of infection by age are still running quite hot in the early working age. And this is the group that are most likely to be socially mobile. The elderly are by and large taking a lot greater care with regard to their contacts, their networks, and their level of protection that they put for themselves, hand washing and distance, etc. Therefore, the opportunity for further takeoff is going to come from the early working age population. I have no real doubts on that one. Looking at the Google and Apple mobility data, that's beginning to increase again. There are certainly signs that the impact of the lockdown is wearing off, and I fear that we've reached the bottom limit of what's achievable by tier 3 level of restrictions. So I do fear that conditions are set for a rapid takeoff, and we're all fed up. I'm fed up. I presume everyone else is fed up. And Christmas is coming. Christmas is going to be quite difficult to manage. We'll probably get onto Christmas in a second. Where next? I think I've said all of that. I have said all of that, so I won't dwell on that any further. We're in tier 3 currently, and that was expected. I didn't know that until it was announced, but it was expected. I was not at all unsurprised by that. This is what we don't know the exit criteria from tier 3 to tier 2. The government haven't published them. We have done some local work on what the exit criteria might look like, or what if we were writing some exit criteria, what they might look like, according to the strategy that we've set: keep people safe, protect the vulnerable, reopen Sheffield. And it's 5 broad criteria: case detection rates in all age groups, case detection in the elderly, both of which are the 7-day incidents, rate at which cases are falling, how fast is it going down or up, and obviously rapid increase or rapid decline rapid decline is wanted, but rapid increase is much more worrisome. The test positivity rate and the pressure on the NHS. The only criteria that we think we would pass is the number of new cases of COVID-19 in the whole population, i.e. the 7-day instance for the whole population. For all of the other criteria, I'm not convinced that Sheffield or South Yorkshire can legitimately say it passes the criteria for moving down a tier. So difficult, undoubtedly, disappointing, definitely, and when we don't know the government's criteria, but I'm not convinced that we passed them, and I think the decision, from my perspective as Public Health Director, was the correct decision. And what will happen next is that there'll be a further review on the 23rd of December, happy Christmas in advance, and a further review on the 30th of December. I would be surprised if different decisions are taken, and I couldn't call that one way or the other. It's important that I'm honest with people, but I would be surprised if different decisions are taken at the next few decision points. I couldn't call what will happen beyond Christmas, or certainly beyond New Year, because it's a reasonable distance into the future, and we'll have the impact of what happens over Christmas to address. The outbreak plan that we have is largely intact. There's no single thing that is a magic bullet, sadly, other than perhaps the vaccine, which I'll come on to, but even that isn't by itself a magic bullet. The links, if people want to dwell on them, are at the bottom of the page, but then the main chunks are the 7 bullet points in the middle, from prevention through to outbreak management testing, right the way through to settings of concern. There's a programme against each of those themes, and we've got named leads that are responsible for each of the themes within the outbreak control plan, and a pretty well-developed infrastructure to deliver, of which the COVID-19 Prevention and Management Board is the thing to which this is held accountable. That mechanism broadly works, notwithstanding the data doesn't say the story we want it to tell. I don't think we're doing anything wrong, and it's difficult to think of things that we aren't doing that we should be, but we are reviewing that plan. We do keep adding to it. Asymptomatic testing is one thing, which I'll definitely come on to, and the vaccine is a second, which I will definitely come on to in just a sec. So yeah, we do need to review the plan, certainly, but the plan is by itself largely intact. I think this is the last slide. Forward look. This slide was written yesterday, the mid-December review. We now know the results of the mid-December review. Christmas, with an R0 of 0.8 and a high rate of infection, that for me underscores the need for care and caution about our social networks and our behaviour over Christmas. Testing by itself is futile. And when the World Health Organization says testing is the thing that makes most difference, they're entirely correct. Testing and all of the things that follow testing is what makes the difference. And the second thing is testing in those with symptoms is by far and away the most important intervention to interrupt disease transmission. And most of those with symptoms don't get tested. Then we come on to asymptomatic testing and lateral flow tests, of which I'll pick up in a second once I've paused for breath. Vaccination, ditto. I'll cover vaccination in a bit more detail in just a second. But whilst it is the best hope of an exit strategy, undoubtedly, until we've achieved vaccine-induced herd immunity, I don't think we can relax. Sadly for me and you, the basic public health fundamental interventions, hand washing, distance, face masks, social networks, will remain the fundamentals until the end. I say it's sad for me because it keeps me exceptionally busy. It's sad for you because you all want a magic bullet. Sadly, they don't exist. My last point, I'm really clear on this. the best way to protect both the economy and our vulnerable loved ones is to keep community transmission as low as possible. The first point on the economy, there's an increasing international consensus on this one. I was reading something really interesting in the Financial Times last week, I think, or was it the week before, where they looked at those economies that have kept the community transmission as low as possible are also those economies that have had the least impactful economic hit. It's a difficult message to sell someone who's trying to run a hospitality industry now. I utterly accept that. And ditto, the best way to protect vulnerable loved ones is not to lock them away, because that has consequences, but to keep the level of transmission low, to minimise the chance of them acquiring the virus from someone. So I'm going to pause for breath there and stop screen sharing before we kind of move on. That's okay.
No, that's fine. Thanks, Greg. Can I just at this point ask if Jamie wouldn't mind just reinforcing what the Christmas rules are, because I think as a board, we have all agreed that although these are the rules that people have to maintain within those rules, that we're actually advising people to seriously think hard about some of the relaxation that are within those rules. So if Jamie if you wouldn't mind just going through what they are.
Yeah, of course, Julie. So why don't I start with sort of what the rules are, and then a bit about actual advice, and as you say, what we want people to think really carefully about. So lots of people will understand Christmas bubbles, but I'll start with the basics to make sure that everyone's on the same page. So this is the concept that between the 23rd and the 27th of December, you can form a bubble with up to 3 households maximum, including yourself, so maximum of 3 households coming together. And those bubbles should be kept as small as possible. So just because 3 is allowed doesn't mean you have to meet 3. And you should only be in one. So, you can't meet some people on the 23rd and then different people on the 24th. And so it's an exclusive situation where there's just your, those 3 households that must be exclusive. To be in that bubble, you can travel between tiers, but you should think quite carefully about how far you travel, and try and avoid staying overnight if you can do. And within your bubble, you must only meet in private houses or gardens, places of worship, or public spaces. So even though in Sheffield we're in tier 3, we might have some people who are thinking about travelling to tier 2, for example, to be part of their bubble. And even though in other places rules might be different, or for example in tier 1 a pub might be open, that doesn't mean you can go there with your bubble. You must remain in private homes and gardens, places of worship, or public spaces. And it's really important to not meet anyone outside of your bubble unless it's within the rules of the tier that you're in. It's important within that to think about vulnerable people. So like Julie said, just because that's the rules and that's what's allowed, that doesn't mean it's the most sensible thing for everybody to do. So please keep in mind kind of thinking long and hard about how you include vulnerable people within your bubble, and how you approach that situation. So for example, by far the safest way to do this is to see people virtually. So you can think about that as kind of a first port of call. And consider, do you really need to meet face to face? The other thing you could think about is, could I be outside instead of inside? So could I meet this person for a walk, for example, instead of going indoors? If you are meeting inside, how can you make that as safe as possible and do that for as short a time as possible? So Greg's mentioned the basics. I think in public health we talk about them a lot, but these are things like washing your hands, using hand gel, cleaning regular touch points, thinking about not sharing things. So for example, do a quiz instead of playing a board game where you might all be touching bits of the game. Have a plated meal instead of a shared buffet so that you're not sort of all touching the same things. In many ways, if you think about what you experience when you go to a shop, for example, where there's sort of hand gel easily available, things are cleaned regularly, the doors or windows might be open for ventilation, and try and replicate that in your kind of home environment, because as Greg said, home transmission often happens because we're more complacent there and we're more comfortable there. And there's no one there with the sort of responsibility for those COVID secure things in the same way we might see elsewhere. Check in on emotionally vulnerable people. So you might know people in your life who are kind of living alone, or who might not have as much contact over Christmas, and that doesn't have to be physically seeing them, but it might be that you give them a call and just see how they're doing and check in with those people. Think about kind of limiting contact now. So this is kind of an important here and now thing, is the guidance advises for a minimum of 5 days you limit your social contact, but we're a week out from Christmas now. So if you are going to be going to meet some friends or family, now's the time to try not to see anybody else if you haven't already started doing it. So keeping your contacts to a minimum now so that you go into that situation in the safest position possible. And communicate a bit in advance what your plans are. So it might be that you know, you're listening to me and Greg and everyone else speak, and you're thinking, oh yeah, we could have hand gel and we could clean and we could do this and we could do that. So you could communicate some of those things to your family in advance as well, and say, you know, we think this might be nice. It might be nice to do a quiz. Perhaps if we watch a movie, we'll have a break in the middle just to get some fresh air and ventilate the room a little bit. So there's lots of things you can sort of think about in advance and communicate in advance. And I'll just sort of finish on two things that sort of seem obvious but might not be, is if you're meant to be isolating, so if you either have COVID, have symptoms of COVID, or have been told you're a contact of COVID, it's really important that you follow that advice and don't put other people at risk. I know that'll be really hard for some people because it'll mean there's this little window of opportunity where they were maybe planning to see some family and they don't want to find themselves in that position. But it's incredibly important not to break those rules and meet with people, because you'll be putting them and others at risk. And also to be really careful afterwards. So if you've had this period over Christmas where you've seen some other people, there's a chance you might have seen someone who's not got symptoms but has the virus. And if you then go on, for example, and see other people for a New Year celebration, you're going to put lots of people at risk. So it's really important that you stick to that kind of not seeing people afterwards and thinking really carefully about what you're kind of doing after that festive period, and how you're acting within the kind of guidance afterwards and taking it seriously. So yeah, that's a sort of brief rundown of bubbles and some things to think about for everyone.
Thank you, Jamie. You certainly gave me a couple of things to think about, and I thought I'd learned everything. I'd learned everything. I think most of us here do. We're sort of discussing it on a sort of virtual hourly and daily basis. So, but I have learned a couple of tips you've given me. I'm definitely going to try and. I am having my parents round. I have decided. They're in their 80s. We've had some, you know, a pretty tough year with them and the health, and so I've decided that, but it will only be one day over those 5 days, not every day, and we're isolating from now on until that. So little things like that when you've got choices, you do it as carefully as possible. Greg, have you got anything else to add before I ask the other board members if they wish to raise anything?
Very briefly, just, I mean, the script that Jamie's had, it came from a really, really helpful Sage paper that was published on 26th of November. I recommend everyone reads it because it's really helpful, very public facing, and it's how to manage risks. I mean, this has been difficult. It will remain difficult. And I'm in the same place as Chief Medical Officer. Just because you can doesn't mean you should. But equally, I'm really clear about not judging people on the basis of risk-based decisions that they've made. I think we're really, really important about that. Throughout, we've managed this on the basis of consent and understanding rather than kind of harder-edged enforcement of the law. But the advice is about minimising the risk. Actually, there are risks. Undoubtedly, there are risks, and we'll work with that. But the advice is to help us all manage that risk as best as humanly possible, so that we can have as safe and happier Christmas as we can. I'll stop there.
Great. Thanks. Is there any other of the board members that wish to add anything that we think we've forgotten? Because, as I say, you've been part of this journey all throughout the year, and if there's anything else that we've not managed to say, but if you think about it, we can do it throughout the meeting. Right, I'll go on to the questions. I have a couple of people that have submitted questions but aren't able to be with us. But if we take the questions, I think one does actually require quite a bit of advice. But I will read it out. It's from Emma Shepherd. And it says, looking at the scientific evidence, it's clear that hospitality is not to blame in the rise in infections. It's mixing in households behind closed doors. When will it be recognised that pubs manage social groups very well and can actually help manage the risk and social distancing? And considering the devastation the draconian measures have had on the hospitality sector, when will the government concede and compensate these businesses adequately to avoid the loss of community asset and British heritage, i.e. the pub? I think more or less from the presentation, the answer has been in the presentation. So I'm going to give everyone an opportunity to say something. But one of the things that we have been particularly keen on is where we recognise we feel there have been failures, and some more serious than others, I have to say, in government's policies, but also in government's instructions and guidance and communication. We have called them out on that, but we've also had to try and compensate for that in where we think the government are letting our citizens down. We've had to try and compensate by producing schemes or advice and further guidance of our own. And one of the things we've said about the hospitality sector is, as I think it was Greg that said, and Jamie touched on it in the presentation, we need the hospitality sector to be here beyond COVID. So even though they're going through a very, very difficult time right now, one of our main priorities is to maintain them as businesses in order to continue to be here beyond COVID. And that's as much a priority as supporting them right now. It's supporting them right now, but supporting them through these closures and these restrictions in order that when we get through COVID, they can come out and continue to be sustainable businesses. So we're doing everything we possibly can to retain those businesses. Does anyone else wish to add anything to that? You know, we are doing everything we possibly can, and we know the government's support is just simply not enough. But you know, we accept that it's a very, very tough time for the hospitality sector. Okay, right, Douglas.
Yeah, thanks, Julie. I mean, I just wanted to say something about, you know, the hospitality businesses in my ward in the city centre that, you know, generally have been very well managed when they've been open. But just to make the point, I mean, you have said this, Julie, but just to make the point, Emma's question, which I think is a really good one, isn't one that we can answer here. It's entirely in the hands of the government. It's governments that set the rules, governments decided how much support businesses get or don't get, and it's government that set the tiers. So that's where we are. But yeah, we'll have to do that. I suppose the other thing that we probably do want to get the message out is just to make sure that every business has made sure it's claimed every bit of grant and support that it can do. Because the message we're getting is that there's still a lot of businesses that think they can't get it, but but could still get something. So we want to keep repeating that, I guess. Thanks.
Definitely. Jamie and then Lou.
Yeah, so just to echo what Douglas just said, I suppose it's a national decision around what can open and what can't open, and it comes down from SAGE, who are the sort of National Scientific Advisory Group, and they did a piece around kind of which things impact on transmission, and when it came to hospitality, that came out as a sort of moderate impact, and that's not because pubs or other places are doing anything wrong. As you say, the vast majority of them do a really great job when they're open of following those guidelines and putting all their COVID secure things in place. It's just by virtue of people being inside, talking without a face covering on, socialising with people who they wouldn't necessarily see in their household, for example. And so, yeah, it's sort of a representation of where we're at the moment, where no household mixing can happen in this tier 3 position, regardless of where it is, so whether it's at a pub or a gym or a hotel or anywhere. So yeah, unfortunately it's out of our hands, but it is based on that sort of scientific review of how likely it is that someone had been in a sort of setting when they tested positive.
Thank you. Lou?
Yeah, I just wanted, just with regards to the grants, I just wanted to say thank you and congratulate the Business Sheffield team and Yvonne Asquith's team in terms of the supply chain grants, because I know that the feedback was given that some businesses were not applying because the amounts were not as substantial. I've seen that those amounts have changed. Personally, I've recommended it to lots of accountants that I work with who've paid it forward to their clients, and they've had people who applied on Monday. They only had to supply 3 months bank statements, proof of their property costs. And if they supply any business in the hospitality, leisure, entertainment or accommodation sector, they qualify and the funds have hit their account this week. So that's a 4-day turnaround, which is fantastic, really. So really just to encourage everybody to look at those supply chain grants and get onto the system so that in future, if further monies come, they're already on there, they're already aware, you know, they're on the radar. But yeah, it was just to make people aware that that is happening and they're turning it really fast, and just to encourage people to take a look at that.
Yeah, great. Thank you, Lou. And I'm sure the team will appreciate your appreciation of them. Thank you. I'll go on to the next question because we've had this before, and it's Claire McKnight who has raised this before, and it's regarding our public transport providers, the operators, where she's claiming that she's using public transport, but the windows aren't open regularly. She's saying that people are often sitting on for longer than where they're on for longer than 15 minutes, not adhering to the 2-metre rules. So it's important that our operators manage, just like we've talked about hospitalities managing their environments, the operators should be doing the same. And the response that we can give her is that we will undertake to raise this with the Transport Authority, the South Yorkshire Passenger Transport Authority, that is, that has links with the operators. I don't know if anyone else wishes to add to that, Bob.
Yeah, just to reiterate what you've just said there, Julie, I'll send an email to the PTE and to operators straight after this meeting to make sure that that's reiterated.
Thank you. Jackie?
Yes, thank you. I think this is really important because I've had this sent to me from some of my constituents who are using the buses, and it's almost as though it was great when we were first. It's almost as they've got fatigue as well, and I recognise it's extremely difficult if you're the driver. You're trying to drive the bus and you can't always see what people are doing, but I do think if we could not just write to the PTE, which you've said, Chair, but as Councillor Johnson has said, Bob Johnson, that he writes to the providers as well, the actual bus companies, you know, and the tram companies, just to remind them. Especially, she brought up the opening of the windows before, and it doesn't take long, does it, just to open the window? I know some people will close them, but I think it's important that they understand why. So some notices up, and I know our public health teams did some great work just doing risk management, working with the PTE and the bus companies, just working out what they could do, how they could do it, and it's just reminding them, really, isn't it? Thank you. Thanks.
Yeah, it's also, we've said this before, haven't we, as customers ourselves, if you get on the bus, open the window and someone will come along and shut it after you, and then you open it again. It's a bit like at home when I'm constantly switching the lights on and Paul switches them off and I switch the heating up and he switches it down. But I think if it's to keep you safe, you just do it, don't you? You just take the risk, you open the windows and politely ask the driver as well if you've noticed that the people aren't keeping that 2-metre distance. That I think it's just fair enough that we should all try and speak up, acknowledging that for some that's more difficult than others. Thank you.
I think it's great if we could politely ask the person who isn't wearing the mask, or, you know, do you mind if we open the window, because it does help when we, you know, and obviously, yes, yeah. You know, but
it is.
Yeah, thank you.
Well, that concludes the questions, but I'm going to ask Greg or Jamie to just talk about vaccination, where we are with vaccination now, because that's I think, of the most interest to people right now. Maybe that's why people aren't coming, because we've got a vaccination and they think it's all over. So over to you, Greg.
Thanks. So this will be a verbal briefing. I hope that everyone's in a queue to get vaccinated, but I don't think they are. So people talk about game changers. The availability of a vaccine is definitely a game changer. No doubts about that. There is one vaccine that's available to us at the moment, which is the Pfizer vaccine, which has been available for 3 weeks. And in that 3 weeks where it's had regulatory approval, thousands of Sheffielders have received vaccination. I don't know the exact number offhand, but it's well into the thousands. And we're in the space where it normally takes about 10 years from a new illness to produce a vaccine. This has taken a year. Credit to the scientists and credit to all of those who've participated in the vaccine trials to get it to this space. It has been done exceptionally well. So we have a vaccine, which is the Pfizer vaccine. The downside of the Pfizer vaccine is that it needs very, very careful handling. For reasons that I can't explain because I'm not scientifically literate enough. It needs to be stored at -70 degrees. And it's very fragile, therefore it needs very, very careful handling. And that limits the speed with which we can do the delivery of the vaccination. But we are vaccinating. The prioritization order for vaccination is set by the Joint Committee on Vaccination and Immunisation, which is a national committee. It's not my call, it's a national call. We're starting with very elderly. So we're starting with the 80 pluses. Our hospital is vaccinating, and there are 3 primary care sites in Sheffield that are vaccinating. And to date, thousands of over 80-year-olds have received the vaccine. It's a 2-dose vaccine, so they've received the first dose. I think that the schedule between them is 28 days between them. So that cohort won't be fully vaccinated until the second dose, 28 days from the first dose. It is safe. The vaccine is approved by the Medicines and Healthcare Regulatory Organisation, which is one of the most robust institutions that we have. And they have cut no corners, no doubt about the fact they've cut no corners. This is far too important for corners to be cut, and no corners have been cut accordingly. I suppose it's important for me to say, don't phone your GP asking, when can I have my vaccine, please, doc? You will be called, and GPs are pretty busy at this time of year. So wait to be called, but you will be called. It will take some time to get through the vaccination program. I think it will take, best guess, 4 months, hopefully sooner, but I think I'd be surprised if it's less than 4 months to get where we're currently aiming to get is everybody over 50 vaccinated. I think we'll actually go down the age cohorts from there, but certainly the current target is to get over 50s vaccinated. The scene will change likely early in the new year when the AstraZeneca vaccine should receive regulatory approval from MHRA. I think it will be early in the new year. I don't know when that will be, but I think it will be early new year. And that will definitely change the game again, because that does not need to be stored at -80. It can be handled rather like the flu vaccine, and it makes it much, much easier to do really rapid vaccination. And GPs stand ready to do vaccination at speed and scale as soon as the AstraZeneca vaccine is available to us, which I think will be early in the new year. And it will be treated rather like the annual flu vaccination campaign. And credit to GPs, they're really, really good at that. Just to give you an example, this year, the uptake of flu vaccination in the over 65s is 85%. It's never been anywhere near 85%. And as a result, by the way, there's vanishingly little people with flu. Who knew that vaccines would work? So GPs stand ready to do that, but at the moment the AstraZeneca vaccine isn't quite available to us. It will be early in the new year. Again, it will be safe. It will not be injected into anybody until it's MHRA approved. Again, it will be a two-dose affair. And it's important for me to say that for an individual, till you're fully vaccinated, you need to keep washing your hands, keeping your distance, etc., etc. You can't let your guard down. And as a population, until we've got vaccine-induced herd immunity, this will not be over. So I think we will need to get almost all of the eligible cohort vaccinated to get vaccine-induced herd immunity. There are the people will worry about side effects. There are side effects with any vaccination. Most commonly and most obviously, site-specific soreness where the needle goes in. That was commonly reported in the studies. People occasionally report mild symptoms after a vaccine. They certainly do with flu vaccine. It isn't symptoms of coronavirus. It can't be symptoms of coronavirus because it's not a live vaccine, so it's biologically impossible for it to be symptoms of coronavirus. But people do report mild flu-like symptoms after that, and again, that was reported in the studies. Much was made a few weeks ago, last week, of the two or three people that had a severe allergic reaction. But all of them, to my knowledge, were appropriately managed by the hospital and treated very carefully and very safely by the hospital, where it wasn't in Sheffield, but it was somewhere else. All of them had well-known allergies and carried an EpiPen with them. The allergic side effects was reported in the trial, and it will happen, but clearly the spotlight is on this, so it will be very, very heavily reported. So there are some side effects, and this can happen. It's important to be really, really honest about that. There are things that we don't know. What we do know is the Pfizer vaccine and the AstraZeneca vaccine, because we've all seen the data, stops people dying. No doubts about that, and it stops severe illness and people dying. What we don't know is whether or not it prevents transmission, because the studies weren't designed to tell us that. We will learn that as we go along. We clearly all hope it does, for obvious reasons, but it does stop people dying. But it's important for me to be honest, we don't know whether it stops transmission or not. Last thing before I shut up, it is the myths that are circulating. I see lots of them on social media. They are myths. The only place I'd recommend that you go for your vaccine advice is either the BBC website, which to its credit is amazing, or a gov.uk website, Public Health England or similar website, or for those that want the technical details, the Medicines Healthcare Regulatory Authority website, both of which are gov.uk. I would go nowhere else. When you read interesting stories on social media, which we all do, I would encourage you to think about sources and think about the motives of people who are putting those stories around. Go straight to BBC, who to their credit have done some excellent reporting and very balanced reporting on this, or to gov.uk websites, both of which are reputable. So it is happening. It is happening as fast as possible. The NHS is the body that's responsible for organising vaccination campaign. They know what they're doing. It is a ginormous logistic exercise, the biggest logistic exercise the NHS will ever undertake, no doubts about that. We as an organisation are ready to help them and are helping them in all sorts of different ways. And it will be the game changer. It is the best route out of the pandemic. My best guess is it will be spring by the time we've got a very well vaccinated population. So I'll stop there. And again, if people do want questions, I'm more than happy to go anywhere on that.
Thank you, Greg. I've got Shafak and then Jackie.
Thank you, Chair, and thank you, Greg. I just want to say, look, I'm looking forward to the vaccination. I'm not particularly bothered which one it will be, and I want to make that very, very clear to people. Just as the MCB, the Muslim Council of Britain, have recommended people for the flu jab, no doubt at all, there will be national religious bodies will be also once again liaising with government and recommending this. So our message today, I'm sure all colleagues on this call will be saying to people from all backgrounds, all faiths, this is about keeping you safe and keeping your loved ones safe. So therefore, as and when you are called for a vaccine, please take it, because I intend to, and I intend to encourage everyone I know, family, friends, colleagues, to go and have the vaccine. As Greg says, when we've had a huge uptake in the flu vaccine this year, Lord behold, less people with flu. Similarly, as Greg says, this is about saving lives. That's what we've been about, Chair, and you have been at the forefront of this, Julie, since the beginning, about saving Sheffield people's lives. And this is not over. And even those people, I think, Greg, if I'm stand corrected, if they've had COVID previously, may well still have to have this vaccine. I think, and therefore that's the clear message from all of us. You know, professional people like Greg in the medical background, but also as your elected representatives at a local level, we are strongly recommending all 560,000 residents of Sheffield to take up the vaccine. And I will encourage every member of my family and my circle of friends.
Thank you for that, Shafak. I completely agree with everything you say. I have nothing more to add. Jackie?
Yes, I agree again with Shafak as well. I just wanted to ask a question, Greg, because this is a two-stage vaccination, isn't it? And you take the one, I just want to clarify that if you don't take the second one, so you don't go back to your second vaccination, it will mean you aren't covered properly. And so I suppose, just echoing what Shafak has said, what we're saying is, please go and get the vaccination and please go for both. Don't just think that you can go for the first one and not go for the second. You need to do both. That's my understanding. I just wanted to clarify that's and get your advice to say that's the right one. And I was going to ask a question because this is another question I've been asked about. If people have already had COVID, do they need to get it? But I think you've said as well. But would you just reconfirm those two? Thank you very much.
Yeah, so you have to have both doses. You're not fully covered if you only have one dose. I think it's 7 days after the second dose that you get the full immune response. I'm fairly certain that the vaccine-induced antibody response is actually more potent than the disease-induced immunity response. One of the things that we don't know is how long that immunity lasts, however. Because the studies haven't been here for long enough. So we will be looking at that and doing the ongoing monitoring that for some time to come. But yeah, entirely correct. The second dose is where the full immunity happens.
And the one, just to clarify, the one that people have already had COVID, if they've had it, they still can get.
Oh, sorry. Yes. Yeah. Even if you've had COVID, if I'd had COVID, I would still be having the vaccine.
Okay. Thank you. Thanks very much.
Okay, right. Finally, can we just say a few words about testing? Because that's been in the news about what people are expecting out there after Christmas, especially schools.
Okay, so briefly, again, verbally. The thing that matters most is getting a test if you have symptoms of COVID. That has mattered most from the start. It still matters most. It will matter most till the end. There are 6 testing sites in Sheffield. Last week, 700 people got a test, of which we diagnosed about 82 a day. So whatever 82 times 700 times 7 is, gives us the weekly volume. So significant numbers of people are getting tested every day with symptoms. Most of those with symptoms don't get a test. And that's really important. So if you have symptoms, no matter how mild, get a test. The testing sites are there, they're open, they want your business, they want to stick things up your nose and send those things off to a lab to diagnose you with or not with COVID-19. Sites are open over Christmas. I think it's now on Sheffield Newsroom website, the opening times of sites over Christmas. There is some slight changes to opening times. It is Christmas, but they are open throughout Christmas. So that's the most important thing to say about testing. Then that takes us into asymptomatic testing and the use of lateral flow devices. So we now have a new test that's available to us. It's called the lateral flow device. It still needs a swab, so you still need to stick something up your nose, really quite a long way up your nose, but it doesn't need a lab, and you get a rapid result in half an hour, 40 minutes. which is good because you can get a lot of testing done, and you can get a lot of testing with rapid results, and you're not reliant on lab capacity. Of course, I'm a cautious scientist, so I'll say there's a but. The but is that they're not as accurate. If you the key problem is the false negatives. So the sensitivity of these tests to correctly diagnose is nowhere near as good as we would like it to be. If I have had a if I might have a false negative, if I've had a negative result that's a false negative and I actually have the illness, that gives me false reassurance. I can then, if I don't behave in the right ways and do the right thing, I can infect others, and that obviously is problematic for all sorts of reasons. So that's the downside, and it's a really, really, really important downside. I'll do a bit of science on this because the science and the nuance really, really matters here. The reason why symptomatic testing is most important is to do with infectiousness is related to viral shedding, and viral shedding is related to symptom severity. So people with more severe symptoms shed more virus and are more infectious. People with no symptoms, probably, we don't definitively know this, but the science is reasonably clear, aren't anywhere near as infectious. So hence, we go back to getting tested if you have symptoms. It remains the most important thing. So at worst, 30% of people with the illness are asymptomatic. And again, there's an important nuance in all of this. That 30%, there's a funny mix of truly asymptomatic versus very mild symptoms. The reality is most of us will have symptoms so mild that we might not notice or characterize it as COVID, and then pre-symptomatic. All of that is mixed up in the 30%, which muddles the science completely, but the nuances matter. Then add into that a test that isn't as accurate as we want. That takes us into a rather problematic space. A lot is made of whole town testing. It was once called, it was then called mass testing. It's now called community testing. Because of all the nuances, it is not a route to a significant disruption of transmission at population level. The reason why Liverpool shifted from tier 3 to tier 2 is because of the restrictions that were in place, not the whole town testing. It's really important to be clear on that. And they're just ahead of us by about a month in the epidemic curve, actually. To give you an example, if disease prevalence is about 1%, which it is about that at the moment, of 1,000 people, 10 will have this illness in any given time period, of which 3 will be asymptomatic. Of those 3, it might be truly asymptomatic or very mild symptoms that they don't notice. 7 will be symptomatic and therefore more infectious. Thus, to find those 3 with a test that is far from perfect, we will end up putting huge effort into something for not much gain, actually. That's the reason why as an authority, we were somewhat reticent to enter into the whole town or mass testing territory. And that would take us away from, and actually we don't have the resources to do that, there's no doubt about that. That would take us away from things that we know matter and know matter a lot, and arguably we should do those things better than we do. We are interested and are actively in the space of wanting to use lateral flow testing in populations without symptoms, but in a very targeted way, bespoke and nuanced to specific cohorts, where we can do most good. And there are a number of specific examples of that. One is around high risk, high consequence settings. So for example, using lateral flow device testing to enable safer care home visiting. It doesn't remove all of the risk, it makes it safer, and it certainly doesn't mean that you can not wash your hands and you can hug your elderly relatives. It's not a path to being able to hug in a care home, but it can make it safer, but it has to be done in the context of everything else. So that's what one potential use. We're actively in that space now. Second one is around testing contacts of cases. And most obviously, the announcement yesterday from Department of Education that an expectation that schools will be entering into this space in the first week of term. There are two identified groups within that, one of which is weekly asymptomatic testing of staff. Honest view, based on the science, is that won't make much difference. Second group is that testing of contacts of cases, be they teachers or be they children. Actually, there's a lot of merit in that one because the risk of transmission is highest, so there's public health benefit there. And also, if you can serially test contacts, you can free them up from isolation quicker than the 10-day isolation period. That frees up the teachers to get back to teaching. They're usually pretty good at teaching, and it frees up the students to get back to learning. So there's definite merit in that one. However, the announcement was made a few days ago. We're not really clear on how it will be resourced, and it has to be subservient and secondary to the amazing things that schools are already doing around making schools as safe as possible and contact tracing, which they are doing, but all schools are doing that very well, and obviously has to be subservient to teaching. So we need to work out how that will be resourced, and the government have been clear with us on that one, actually. And I'm speaking personally and honestly, schools are quite tired and they need a rest over Christmas. So we'll be working with schools to work out the best way to do that, but it won't be ready by the first week of school term. There's no doubt about that, because it just can't be done logistically over the Christmas period. It just can't be. Schools will be off. Schools need a rest. They've worked pretty hard for quite a long time now. So we definitely in this space, but we're doing so in a way that where we can make it work properly to the best benefit of all. Sorry, that's a long verbal briefing of a techie area, but it's important that I went through some of the techie stuff.
No, I think it's I think you do. First of all, I want to say I think you are one of those people that, although you can explain very complex things in a very complex way, you can also explain very complicated and complex things in a simple way. Because trust me, working with you over the last 10 months in the extremely close environment that we've had to work together, and along with other board members, you've made it far easier for me to understand an awful lot of that technical and scientific work. So even though you do introduce the science and the techie stuff, I still get it. So thank you very, very much for that. Right, I think that more or less concludes. Oh, Jackie.
Could I just have a question, please? Sorry.
Yeah, you can.
Just very quickly on the testing. You said, Greg, in your presentation that sites would be open over Christmas if people had symptoms. I just wondered, because I know we had some walk-in sites that then didn't become walk-in sites because we were having too many people coming forward. If people do have the symptoms over Christmas, do they still have to go through the telephone number and book a time, or will there be any walk-in sites open over Christmas? I just wanted to ask that, please. And if they could find out, would it be on our website if you don't know yet? Thank you.
It is on the Sheffield News website. I'll make sure the post is fairly widely circulated. Walk-in is acceptable. Booking is preferable. The Department of Health made that clear. But there is if people walk up, they will get a test.
Thank you very much. Thank you.
Thanks for that, Jackie. Because I had text Eugene just to say that can we make sure that when we've got the full cover arrangements for Christmas, can we make sure they're all pulled together on the website? Because you know, we have that helpline 27345567. I want to make sure that's available, particularly as we've talked about vulnerable people, especially vulnerable this Christmas more than ever, and being able to get advice at any time of day, at any time over Christmas. So we really do need that helpline to be available as far as possible, but that will go on the website hopefully. So it does conclude. Shafak said you've got a comment, Shafak.
I've got one more.
After we finish with all the normal business, Chair, right at the end, I just want to say something.
Okay,
Right,
then just
like
finally,
one-
if we, Greg.
Yeah, like one final bit of any other business. I suspect might be the same as Shafak's.
Go on, Greg, you lead on. I'll come in. I'm sure Jackie's got the same.
Well,
Go on,
so
Greg.
I'll be quick. Julie, you made a personal point of thanking me at the end of the cabinet meeting the other day. So this is right back at you. Thank you for your personal leadership throughout the whole course of the pandemic. You've been safe, reliable, dependable, solid leader. As a city, we're in a better place for it. We'd be in a worse place without your leadership. I think you've done an amazing job, and I just want to wish you all the very, very best with whatever you choose to do next, whether that be an active citizen or anything else. All the best wishes, and see you on the other side somewhere.
Oh, definitely. Thank you.
I
Shafak.
mean, look,
So I am
absolutely.
going to have the final word.
No. Listen, listen. This was in nobody's plans last year, and definitely not in your plans, Julie. And the easy thing for you could have been just to say, look, no, I was stepping down in May, and I'm going. But actually, Chair, to your credit, you stuck with us. More importantly, you stuck with the city, and you've had the most difficult job. I mean, the rest of us councillors, you know, we've been here, we've been able to add to it, but actually the day-to-day running of the council, despite the pandemic, despite your own personal family commitments, you know, you have stuck with us, and I just wanted to make sure that we all say a big thank you. And I do personally wish you, the boys and Paul, well for the future, and have a happy Christmas, a Merry Christmas and a Happy New Year.
Thank you. Jackie.
Yeah, sorry, I just want to say, just to echo Greg and Shafak's comments and say, for me, your leadership, Julie, the thing that makes it, especially in this pandemic, you have had always, as ever you are, the people of Sheffield, all the people of Sheffield, no matter who they are or where they live, at your heart. And you've also been no nonsense, as I call it, you know, setting up of this outbreak and control board, as it was called. You said straight away, we don't need the great and the good on there. We need people who are out in our communities, who are doing the work, and they have come along and they have made a difference to the and impacted on our outbreak plan, on our vision and everything. And throughout, that vision has been strong and solid, and always a touchstone with what would people think, how do people feel, what can we do to make it better. And I think the fact that we've done so much to support people who have been vulnerable and who haven't, to involve the community and faith sector involved in this, and local councillors involved, and everything we've done has been due to your leadership. And it be in general, but in this particular case, during COVID, we've needed you, or somebody like you and Greg, the team. I hope you weren't too close, as Jamie said. No hugging and kissing. When you said we're very close, not too close, socially distanced properly, you know, we know. but I just think it's been brilliant. You've done a brilliant job, and you know, I wish you all the best. Anyway, thank you very much.
Well, thank you.
Yeah.
Douglas.
I obviously just want to add to that. I thought Shafak's words were very nicely well chosen. What's been nice about this is it's demonstrated that we can work together. And of course, we spend a lot of time disagreeing with each other so much, but it masks the fact that, you know, when it comes to the crunch, there's an awful lot we agree on, and we don't have to agree on everything. But yeah, go for it, Julie. We'll see you not too far away, I'm sure.
No, I will say my thank you in a moment, but just to say in response to both Shafak and especially you, Douglas, is I do genuinely, I've learned quite a lot myself on the way that we have worked together on this particular issue, especially with the wider community. As Jackie said, it was so important to get the people that are the conduit to our community on this panel. and not just the people at the, you know, chief exec level or senior officers at the trust and the hospitals and the universities and everything else. It was really important to do that. But, you know, if we could work, if I could believe that we could work like this on everything, you might win me around to the committee system. And there you are. I said it first, because I do genuinely believe working together is made it all the more through this so difficult. I've never known a difficult period in my whole career in anything that I've done as this, but this particular board, and especially Greg, and he knows what I think, and Dan and Jamie and the whole public health team and the council itself, I think have just clearly demonstrated that when in need, we can all pull together and do the right thing. And yeah, I think it's a lesson for doing things in this way in the future. And I hope Bob's here listening to it as well, and as you two leaders, I certainly think on some of the big issues, certainly things like climate change, like place shaping of the city, and those really big things that we should be working together on in this manner. So thank you very much. And I will send an email to the board. Dan will have to send it me through because I haven't got all the addresses. But I will thank everyone on the board for their contributions, because as you said, Jacka, we couldn't have achieved it without these people on this board helping us and guiding us through. And I've also said it's not what happens at the meetings, it's also knowing and having the comfort and confidence in between that people are there supporting you and everyone's supporting each other on this issue. So thank you very much. And to the public out there, thank you for doing what you should be doing and not doing what you shouldn't be doing, and keep up with it and stay safe, everyone. So thank you.
Thank you.
Thanks a lot.
Thank
Bye,
you.
everybody. Thank you.
Bye.
Thanks,
Have a nice
everybody.
Christmas.
Merry Christmas.
Yeah.
Merry
Happy
Christmas.
break. Take
Yeah.
care. Stay safe.
Bye.
Bye.